therapy. We're thrilled that you're here with us. I just wanted to remind you that we can't answer any questions today specific to your account, to your personal insurance. So if you do have questions that are specific to your child or your bills, please reach out to us later. During the event, if you have a question that comes up that's process related, please email us at webinars@metroehs.com, and webinar singular at metroehs.com, and we'll get to that as soon as we can. We are so excited, like I said, that you're here. If you need anything at all, we are happy to help you. These ladies are excellent. They are so friendly and willing to do whatever they can to make things work for you and your child. So with no further ado, Tiffany and Jessica, why don't you introduce yourselves and get started? And just you go ahead and share your screen.
All right. I'm Jessica Little. I'm the financial care coordinator here at Metro for about 3 years, and I've been in the health and wellness industry for about 10 plus years. To my right is...
Hi, everyone. Good afternoon. I'm Tiffany Peters. I am the Director of Billing here at Metro. I have been with MetroEHS for 6 years now, and I have been in the field of medical billing for over 21 years.
Today, we'll be touching on the following. I just want to give a brief overview as to what we'll be speaking on. We will be hitting on insurance deductibles, copays, and co-insurances. What is an EOB? Accepted insurances at Metro, scripts and referrals, cost breakdowns, autism and insurance, patient insurance and Metro EHS's responsibilities, community mental health phone numbers and information, and secondary Medicaid coverage.
Hey guys, have y'all shared your screen? Or are you about to?
We have shared it.
Okay,
Yeah.
I'm not seeing it, so I just want to make sure that it's up for everybody to see.
All right.
Okay.
Let's try it again.
Can you see it now?
It's coming. It's loading. Give it just a second. Here we go. It's loading. I see it. All right, we're ready.
All right. Sorry about that.
That's okay.
No problem.
Jump right in.
All right. So what is insurance? It is a practice or arrangement by which a company or government agency provides a guarantee of compensation for specified loss, damage, illness, or death in the return for payment of a premium. It's a lot of different big words that we find within our insurance company information, but to give you a little bit of a breakdown, a premium is the insurance's premium, that is the amount that you pay for insurance for your policy. So simply put, premiums are just what you pay insurance companies in exchange for coverage. Now, your deductible, if you have one, is a flat amount that you pay each year to cover medical expenses or services that are done throughout your yearly visits. Now, insurance will pay for those services usually after that deductible has been met. Your out-of-pocket would be your expense for the medical care that aren't reimbursed by insurance. So the out-of-pocket cost includes deductibles, co-insurance, co-pays, and any other covered services or costs that the services that are not covered through your insurance. Now, what is the difference between an out-of-pocket and a deductible? So your deductible is the amount that you'll pay in a single year for covered services before your insurance begins to pay for your care. So that means your out-of-pocket maximum is what you'll pay in a single year before your insurance covers 100%. This can differ for different families. The deductible can be as high as $6,500 or as low as $250. And then after that, your out-of-pocket can range as well. And then you can also end up with a copay or co-insurance. Never both. Very rare if it does happen. Now, the out-of-pocket deductible will vary from plan to plan, as I mentioned, and will restart in your insurance calendar year. What I mean by some policy plans go from July to July, others go from January to January. Once those restart, that means your deductible amount is back at the amount that you started at. and has subject to change depending on what your employer plan is. A little more of a breakdown as to coinsurance. Now, the amount of medical costs that a patient has for reimbursing the health insurance plan after the deductible. Coinsurance is often a percentage of the cost and is solely defined in the health plan itself. Unfortunately, we don't get to pick it. It's whatever is listed within your plan. And sometimes it can vary on the type of service that's provided. So for example, you could be getting at your doctor's office a $25 copay for your regular doctor's visits. But you could come for therapy and it could end up being a $40 copay. But that's what's selected, or coinsurance, I'm sorry, jumped down to copay. Your coinsurance could be 15% or jump to 20% depending on where you're getting your therapies. To jump back to copayment, that's what I was speaking on before, is that your copayment can be different in different realms. Sorry for that confusion. Coinsurance maximums are the total amount of coinsurance that an individual can pay each year before the carrier covers 100%. So that means you have a coinsurance maximum, let's say, of $1,200. This is fitted under your deductible amount. And once you've hit copays that reach that, or coinsurances that reach that maximum amount, then your insurance will pay for everything in full. So you may see two different deductibles listed, one that will say coinsurance maximum deductible and another that says deductible. Those can be confusing and is a lot easier once you contact your insurance company to ask what services fit under which deductible. It's very hard to tell with just looking online. Now, copayment, like we said before, is copay for short, and is the amount that you have to pay your health insurance towards your deductible until that has been met as well. A PPO, a preferred provider organization, is the type of health plan that includes network preferred providers. This means doctors, hospitals, labs, and other providers within that network that maintain contact with the insurer or health plan in order to provide care at a discounted rate to members. That means we're in network versus out of network. So if you ever see someone out of network, you want to verify with your insurance company on whether or not you still receive coverage. Anything in network, you should still be able to receive coverage, but it still can be limited to what the plan allows. HMO. Now, most members in HMOs can choose a primary care physician and make necessary referrals and to specialists if needed. They will also facilitate hospital care. Now, in most cases, members, but also the HMO plans can help offer drastically reduced benefits for out-of-network providers. So we would like to be careful with the HMO. You need to make sure that where you're going is a selected provider or doctor to make sure you get all the coverage needed. Habilitative. This word's very important in our realm. Habilitative means learning an ability that a person has never had before. So the developmental delay or fine motor skill development hasn't been there. We're trying to teach them this. And the reason it's so important to know this word is a lot of this is used with our billing. Rehabilitative is also used, which is when a person has a skill, lost it by injury or surgery, and is trying to get it back. Now, this can happen by accident. Habilitative being so important in our industry is because our diagnoses tend to be in that habilitative realm. And insurance companies need very specific information to know that's what we're treating. And if we ever need to verify or check, we need to make sure we're listing it as habilitative care unless it is a rehabilitative instance. Both diagnoses and codes can change depending on which one of those we're treating. EOBs, explanation of benefits. We have an example today that shows the breakdown of an EOB. And at this point, I'm going to let Tiffany jump in. She's a lot more familiar with the EOB information.
Absolutely. So these are very, very important to review. You should always receive an EOB from your insurance company, whether you're going to the ER, even if you're filling a prescription, they should give you a breakdown of what the pharmacy charged your insurance for, if you have a copay or anything like that. This gives you a full breakdown of what your doctor, you can see under total charges, this is what the doctor has charged. That minus discount is going to be what the insurance has basically adjusted off, because they're only going to pay claims at their allowed amount based on that provider's contract with them. So then it's going to show you what the insurance has paid. And then it's also going to show the amount you pay, which would be your deductible or your copay for that service. And then this will be attached in your EOB statement. It's also breaking down some of the things that that Jessica has broken down already, like your out-of-pocket maximum. And then it tells you what everything basically means on that EOB, so you can get a better idea, better understanding of that. And then this next page will literally break down every single procedure code that your provider has billed to the insurance company. And again, what they've paid for the service and what your responsibility is. So I know that it's to the side, but it's very important that when you do see something from your insurance company, pay attention to that and review it in its entirety, because this is where you can also catch, any kind of discrepancies or errors, something that you maybe didn't know was billed to your insurance company, and you can reach out to your provider and review that information with them.
All right, MetroEHS accepted insurances. Now, these are all employer-sponsored plans. So Blue Cross, Blue Shield. That includes any out-of-state plans. Blue Care Network, Aetna, United Health, Federal Blue Cross, HAP, and Cigna. Scripts versus referrals. Now, script is a formal communication from a physician or other registered healthcare professional to another provider, authorizing them to provide service to the patient. The transfer of care is a referral for a patient in a form that a clinician or clinic by their request. So this is a pre-approval that allows a patient to see the specialist or doctor within the same network. Again, that's that in and out of the permission for services. This only typically applies to HMO plans and Medicaid CMH plans. I brought with me today a cost breakdown. This is typically what I would send our clients about a week before they're about to have services. So this way I can see exactly what services they're coming in for, and I can try to break it down as simple as possible to let each one of you know exactly what your cost would be. In this case, I chose one of our most popular insurances for the state of Michigan, which is Blue Cross Blue Shield. I'm utilizing their rates and their contract with us. So for example, speech therapy per Blue Cross Blue Shield rates is $120.45. Now, I'm going to make the assumption, because I'm not sure yet what therapy is going to be required for this child. So I took an assumption of 2 visits per week on average, which would be a total of $240.90, and then a monthly cost of $963.60. Now, the fake person's insurance, pretty much after this one, give or take another visit or so, our deductible. That will be. That being said, we could work out a payment plan to help pay down that $1,000. But I also want to make sure you're aware that as you're paying that $1,000 down, you'll still have a copay or coinsurance depending on your insurance plan. So the example below is the coinsurance amount that would cover your services now at a discounted rate.
At 20%.
Yes, at 20%. So the speech therapy now goes down to $24.09, 2 times a week still at $48.18, and then the cost per month, which is now down to $192.72. And I'd put that information together with the $1,000 that you've already met, and we'd come up together with a payment plan throughout the next 8 to 12 months. So this is something that's very doable. I just want to give you an introduction to how we look at our breakdowns and rates. Now, we can do this for your specific child and their plan. as long as we have all the information needed from the insurance company. Patient responsibilities and questions to ask insurance companies. This list can go on for quite a while, but we try to give you the most common questions. Yes. So each plan differs. And as a provider, we're giving very basic benefits. Deductible, out-of-pocket, co-insurance, copay, and that's pretty much it. Visit limits are kind of 50-50. Yes. For the most part, they're clear. So contacting your insurance company and walking through your coverage to gain knowledge is really best practice. Again, we give our best estimated cost that we can per our contract with the insurance company, but the more information you can get from them over the phone, the better, because I will say members calling in get a lot more information than the providers. Now, using keywords like habilitative therapy is very important when you're asking questions to your insurance company, especially if you're calling to say, do I have speech therapy? Do I have that coverage? If you say, I need to get, the answer before might have been a straight yes. The answer after might be a no, you need authorization, or you need this from your doctor,
or we only cover rehabilitative services.
Right. So that's why habilitative, like I said earlier, has become a very important word for us. How much will we have to pay out of pocket before insurance covers payments? This helps solidify the information that the health insurance is going to give you and helps you match it with what we've already found out as well. And that way, if there is some discrepancies, we can make sure we figure out exactly why our information is different than theirs, and then contact the insurance together to find out what we need to do to make the best interaction and contractual information to have in our system so the incidents don't happen again.
Yes, we always want to make sure that we're all on the same page. So we have done it on several occasions where we will do 3-way phone calls with you, the insurance company, and us on the line so that we can all clarify that all information that's being provided is accurate. Okay, so now I'm going to jump in and talk about autism and insurance. Each healthcare plan differs, and we have run into situations where families have automatically assumed that everything is unlimited because their child has an autism diagnosis. So I do want to definitely touch on this. Visits are not unlimited for all plans with an autism diagnosis. So it needs to specifically be stated in your plan that this plan offers unlimited visits with a diagnosis of autism. And we do want to put out there that your employer may offer the option to purchase what's called a separate rider on your policy if you don't currently have it, and that rider will allow for the unlimited visits, but you will need to reach out to your HR department or your insurance directly to look into that rider. We have seen many families that have been able to add that additional rider to their policy so that their child could benefit from the unlimited visits. These visit limits are set by the insurance company, and they can only be changed, and this is only sometimes, if with appeals or submittal of medical necessity. We have had success with these before, but they're not always granted, and they can be difficult to submit depending on what kind of medical record documentation they require. Medical necessity may prove the need for more visits, but solely depends on the insurance company ultimately. And then that primary diagnosis of autism, it must be done by a licensed psychologist. We have received scripts before from pediatricians, but unfortunately, that is not sustainable for us to bill with autism. We need to have that full diagnostic report from a licensed psychologist. And then I put on here, HMOs and some PPOs do require prior authorization to receive services, even with that autism diagnosis. And then we also have some plans that have age restrictions and will not provide therapy for kiddos after the age of 6, correct? Yep. So they require treatment to have started after the age of 2, but it must begin before the age of 9. So that is something that's also important. We didn't put that on the frequently asked questions, but it is also important to check with your particular plan to see if they do have age restrictions for therapy. So I want to also talk about Medicaid. There are some Medicaid HMO plans that MetroEHS is directly contracted with. Those plans are Blue Cross Complete, McLaren Health Plan, and HAP Care Source. So for those, we can bill them directly because we have a direct contract with them. So we know that there are many other Medicaid plans and Medicaid HMOs, Straight Medicaid, Molina, Aetna Better Health, Total Health Care, Priority Health Medicaid. We do not have contracts with these plans, so we cannot bill them directly. However, we do accept kiddos that have those plans, but you will need to contact your community mental health department in your county. And what they will do is they will set you up with an intake process. After this intake, then you'll be assigned a supports coordinator. That supports coordinator is going to work directly with MetroEHS and provide authorization so that your child can get services with us. That process is kind of lengthy. I do want to put that out there. So if your kiddo does have one of these plans and you are looking to receive services with Metro, it's best to start that process as soon as possible because it can take 60 to 90 days to get that process fully completed. I do have a list of the county phone numbers here, and I can definitely send these out to any attendees that would like this information as well. And we do want to make it clear that it is the family's responsibility to contact the community mental health agencies to coordinate these services. We are unable to assist with the actual initiation of this process. So after you've already gotten into the system, completed your intake, you have your supports coordinator, that's when we can jump in and start working directly with that supports coordinator on a regular basis to coordinate care. Secondary Medicaid coverage. So we do understand that some patients may also have Medicaid as a secondary coverage in addition to what they have from their parents' employer's plan. So since we're not directly contracted with Medicaid, again, you will still need to follow the same process that I previously discussed and complete that intake process with your county CMH. Otherwise, we will not be able to bill any deductibles, copays, or anything to that secondary Medicaid because we don't have that contract. If you follow the intake process with the CMH, we can bill the deductibles directly to that CMH county. And we definitely want you to know that they will not backdate services. So that's why it's imperative to let us know from the beginning if there's a secondary Medicaid, because if your child has already received services and they're hitting the deductible, and then you're finally able to get that intake with CMH, they will not backdate. So any services that have already occurred, you will still be responsible for that out of pocket from your primary insurance. All right. Does your child have an autism diagnosis? So because we don't have that Medicaid contract, in order to use the community mental health services for authorization, your child must have an autism diagnosis. Unfortunately, that is a CMH requirement. And again, we will need that documentation in the form of a diagnostic evaluation from a licensed psychologist that shows that your child has that diagnosis. So we did want to go over, because we all have a responsibility here in the care of your child. So we wanted to go over what our responsibilities are, what the family's responsibilities are, and then what the insurance company's responsibilities are. So for Metro, our responsibility is to verify insurance is active before services are rendered, check the benefits for all scheduled services. Again, these are basic benefits provided by your plan and are subject to change based on what your insurance deems payable. But we do want to provide you with that basic outline of what your insurance is telling us is covered. We're responsible for following up on claims. Claims can take between 30 to 90 days to be processed based on the insurance. So we do want you to understand that as well. Once we bill a service, we have to wait for the insurance to process it before we know what they're going to pay and what they're going to charge you. So this can take 30 to 90 days depending on the plan. Some of our payers are pretty fast, but we do have some payers that take a lot longer to process claims. Another one of our responsibilities is finding out if authorization is required. and then obtaining that authorization if needed. So it is our duty to ensure that your services are authorized before treatment is rendered. And then another thing we're responsible for is mailing or emailing statements to families to notify you of any balances that your child has accrued during services. Family responsibilities. It is also the family's responsibility to make sure their policy is active and current before services are rendered. Confirming all insured are active on the policy. We've had some situations where families thought that their child was listed on their policy, and we went to verify benefits and they were not. So we do expect the families to know and confirm that all insured are active on the policy. Updating coordination of benefits information if your child has more than one policy. So say your child has a policy through mom's job and a policy through dad's job. It is imperative that that information is updated with both policies, letting them know which plan should be primary, because otherwise we run into a coordination of benefits situation where neither plan wants to pay because they're saying, nope, the other one is primary. Another thing is understanding your specific insurance plan. It's recommended that you check yearly, or if you change plans in the middle of the year, and your benefits, because definitely stay on top of filling out all necessary paperwork upon first visit to the clinic. We do have a lot of documentation that has to be filled out, as most offices do, so making sure that you're filling all that out before the first visit so that we have everything set and verified. And then informing Metro of any insurance changes or secondary plans or demographic changes like address, phone number, email. It's very important that all of that information is updated, because you may have therapists reaching out to you. You may have other administrative staff reaching out, just to confirm appointments and things like that. So it's imperative that that information is updated. And then finally, the insurance company's responsibilities. They are responsible for timely processing of claims, submitting timely EOBs, those explanation of benefits, to families for all services rendered. You should, like I said before, receive an EOB for any medical care, even pharmacy prescriptions being filled. You should always get an EOB from your insurance company. Properly applying copay, coinsurance, and deductible amounts. Notifying families of appeal rights. If there's ever a time where they say deny your child visits, if we request visits or authorization and they deny it, you should always have appeal rights, and your insurance company should be notifying you of those appeal rights. And then thoroughly explaining the reasons for denied claims. They are also responsible for mailing you updated insurance cards. If your plans change, sometimes group numbers change, alpha prefix changes, they are responsible for sending those insurance cards out to you. And then also for supplying contact information for member services and claims questions. So this next little colorful diagram here is something that a couple members of my team created, which is very helpful. It's basically walking you through the process. It asks simple questions. If you say no, this is what happens. If you say yes, this is what happens. And we are definitely going to email this out to all participants so that you can review this in more detail, because I know it's a lot. But we do want you to have this readily accessible. And if you have questions regarding this, you're more than welcome to reach out to us as well. We'd be happy to answer those questions. So in conclusion, we want to thank you all for joining. We realize insurance can be difficult to understand. We hope that we were able to alleviate some of the stress or pressure that comes with understanding how our billing team, with any questions or concerns related to your specific policy, we can definitely look further into your own individual plan, and we'll do our absolute best to answer your questions. So there's our phone number and our email.
Thank you.
Great job, ladies. Thank you so much for sharing all of that. And you certainly know more. I learn something every time I talk to you all. You know so much about your field, and we're very grateful to have you as part of the MetroEHS team. We do want to let you know, folks, that we are going to try to email you the recording of this video and the document that Tiffany mentioned. If you have any other questions, please don't hesitate to reach out, and you can email me at webinar@metroehs.com, or you can reach out to our billing and insurance team through our direct line at MetroEHS. I did want to give you a little bit of a teaser. Next month, we will be doing another webinar on physical therapy. We will include a pelvic floor to kind of explain what kind of therapy that is, and potentially some potty training talk. So please tune in next month and be watching our social media for information about that. Thank you so much, and we will see you soon. Bye-bye.
Thank you.
Thank you.